In honor of April being C-section Awareness Month, I thought we can go over some of my most frequently asked questions in regards to C-sections. My name's Sydney, I'm a labor and delivery nurse. Make sure you follow on here and on my other socials for more information and tips and tricks. A lot of people want to know how long a C-section is, and this varies from person to person, usually with your first being quicker than your subsequent C-sections because you have a lot of scar tissue that builds up after time once you've had more than one C-section. Usually it's anywhere between 30 and 60 minutes. I would say average around 45 minutes. The fastest part is getting to the baby, which takes usually only 5 minutes, and then the rest is just sewing you back up again. Question number 2 is, can you do skin to skin in the operating room? And the answer to this question is yes. Sometimes you won't be feeling your best, and this is when having someone like your birth partner next to you who's willing to do skin to skin and is ready, that's a really great option just in case you're not feeling well, but usually you can still, this part of your body is still exposed if you would like to do a little bit of skin to skin with some assistance from the people around you. Another question is it gonna hurt? The spinal anesthetic that you get for the C-section, or if you've been in labor and you had an epidural top-up, this is gonna numb you from about your nipple line all the way down to your toes. You aren't gonna feel much pain at all, if any, and if you do feel any kind of pain, you have the anesthetist right at your head ready to give you any kind of medication to stop that pain. What you will feel though is some tugging and pulling and pressure, especially when they get the baby out. And this is because it's not that great at preventing pressure feeling, but it does prevent the pain. People ask if they can just be put to sleep, and trust me, I get it. If I had to go for a C-section, I think I'd be a little bit scared to be awake during surgery as well. But this isn't the best option because being put to sleep and intubated when you are pregnant is a very difficult procedure just because of the extra weight you have on your lungs and the way your airway is. This is, again, something that an anesthetist can talk to you about, but it makes it a little bit more challenging and something that we only want to do in emergency situations. Another thing is that some of that medication that we give you to put you to sleep would go to the baby because we can't immediately get the baby out before the medication has put you to sleep. So we usually like to put you to sleep after the baby has come out. This is an option because that way the baby won't receive any of the medication that is very strong and can sometimes cause some adverse effects for the baby when they are first born. Remember, you are strong no matter how you brought your baby into this world.